Sweet Defiance: How Resilience Rewrites Our Health Stories. The first time I met Greta Wiggins Randolph, something profound happened in that room, something electric that transcends words. There's a quality about her that commands attention without demanding it, a quiet power that speaks volumes before she utters a single word. Here's a woman who has faced down type 1 diabetes since childhood, navigated a healthcare system that wasn't built for her, and emerged not just surviving, but leading a revolution in how Black women approach health advocacy. Greta isn't just living with diabetes, she's transforming how an entire community understands resilience, education, and connection. Her work has touched thousands, creating ripples that will benefit generations to come. When we talk about chronic illness in America, we often speak in statistics, cold clinical numbers that fail to capture the human experience behind the diagnosis. But what happens when your body becomes a battleground before you've even learned to spell pancreas? What happens when medical racism compounds the already complex journey of managing a chronic illness? These aren't hypothetical questions. For Black Americans who are 60% more likely to be diagnosed with diabetes than non Hispanic white Americans, these questions shape daily reality. But statistics don't tell you what it feels like to be a Black child with type 1 diabetes, facing down bullies who mock your condition or doctors who dismiss your symptoms. Resilience is power, Greta told me, her eyes steady and unflinching. But not the kind they try to sell us, not the just push through it kind. Real resilience comes from knowing when to fight, when to rest, and when to completely rewrite the rules. And rewrite the rules she has. Imagine being 10 years old. Your body is betraying you in ways you can't understand. You're thirsty constantly. You're losing weight despite eating more than ever. You're exhausted, irritable, confused. When you finally get a diagnosis, type 1 diabetes, it comes with a lifetime prescription of insulin injections, blood sugar monitoring, dietary restrictions, and constant vigilance. Now imagine navigating all of that as a Black child in a healthcare system where the educational materials don't feature people who look like you, where dietary recommendations don't consider your cultural food traditions, where doctors often miss the nuances of how diabetes presents differently on darker skin. I learned early that education isn't just about getting good grades, Greta shared. For me, education was literally survival. This is where her story intersects with so many others. How many of us have sat in doctors' offices nodding along to instructions that don't quite fit our lives? How many have swallowed questions because we didn't want to be labeled difficult or non compliant? The Black Women's Health Imperative understands this reality intimately. This national organization has been fighting for health equity and wellness for Black women and girls with a significant focus on diabetes, education, and advocacy. Their work acknowledges what Greta learned through lived experience. Black women face higher rates of diabetes complications, limited access to culturally competent care, and persistent stigma around chronic illness. What makes their approach revolutionary is how they've transformed the narrative. Instead of just highlighting problems, they've created solutions, targeted education campaigns, peer support groups, and policy advocacy specifically designed to improve awareness and care access. Their Change Your Lifestyle, Change Your Life program has reached thousands, reducing diabetes risk and empowering women with knowledge and tools that make sense for their actual lives. When I found community, people who understood both the medical and cultural dimensions of what I was going through, Everything changed, Greta explained, her voice softening with emotion. Suddenly, I wasn't just surviving with diabetes, I was thriving despite it. Consider the story of Crystal Bauer Socks, a talented Black singer songwriter and American Idol finalist who, like Greta, was diagnosed with type 1 diabetes as a child. Managing blood sugar levels is challenging enough in everyday life. Now imagine doing it while performing on national television, touring the country, and navigating the high stress music industry. During American Idol, Crystal was hospitalized due to diabetic complications, nearly missing her chance at the finals. That moment could have defined her, could have been the end of her story. Instead, it became a turning point. Rather than hiding her condition, she chose to become an outspoken advocate, openly discussing her daily management, embracing technology like insulin pumps, and connecting with fans who share her diagnosis. What Crystal did, Greta noted with admiration, was transform something that could have been her greatest weakness into her superpower. That's what I mean by resilience. Crystal's openness has raised national awareness, encouraged others to seek help, and broken down stigma through transparency. She's inspired countless young people of color with diabetes to pursue their dreams and speak openly about their health. But individual resilience, while powerful, isn't enough. Systems need to change too. This is where initiatives like Project Power become crucial. An American Diabetes Association program specifically designed to address diabetes in underserved Black communities. Project Power recognized something that should have been obvious. Traditional interventions weren't reaching Black families effectively. The high rates of undiagnosed diabetes, lack of access to preventive care, and deep rooted mistrust of the healthcare system required a completely different approach. So they created free workshops, family centered programs, and partnerships with Black churches and community leaders to break down barriers and build trust. The results speak volumes: improved diabetes knowledge, increased engagement in self care, and measurable reductions in risk factors in pilot cities. What I love about Project Power, Greta shared, her face lighting up, is that it meets people where they are. It doesn't lecture, it listens. It doesn't blame, it empowers. This shift from shame and secrecy to empowerment and action is revolutionary, especially for Black women facing health challenges. It's about dropping the cape of invincibility and embracing the power of vulnerability. It's about redefining strength not as suffering in silence, but as speaking up and demanding better care. For too long, Greta said, her voice both gentle and resolute, we've been told that being strong means enduring whatever comes our way without complaint. But true strength is saying this isn't working for me and advocating for something better. I watched her face as she said this, the slight lift of her chin, the steady gaze. This wasn't just talk. This was a woman who had lived these words through countless doctor appointments, through nights spent researching her condition when medical professionals fell short, through conversations with other Black women seeking to understand their bodies and their health options. When Greta speaks about education as survival, she's not being metaphorical. For people with diabetes, especially those from marginalized communities, understanding your condition, reading, asking questions, and seeking out the truth can literally save your life. Don't just accept what you're told, she advised, leaning forward for emphasis. Dig deeper, especially when the stakes are high for your health and your future. This fierce self advocacy isn't about being difficult or demanding. It's about honoring yourself enough to ask the hard questions, to seek second opinions, to research until you find answers that make sense for your body and your life. And sometimes it's about finding the right community to help you carry that load. Whether it's your family, your kids, or the broader Black community, Greta emphasized, support and connection are everything. I'm living proof that with the right people in your corner, you can overcome even the most daunting obstacles. This brings us to perhaps the most powerful aspect of Greta's story, the way she's turned her personal challenge into community empowerment. She's discovered that her purpose extends beyond her pain. There's something transformative, she reflected, about taking the very thing that could have broken you and using it to help others stay whole. This isn't about toxic positivity or finding the silver lining in suffering. It's about reclaiming agency in a narrative that too often casts Black women with chronic illness as victims rather than victors. So, what does all this mean for you listening right now? If you're managing a chronic condition like diabetes, know that you're not alone and your experience matters. Your cultural background, your family traditions, your specific life circumstances, all of these should be considered in your care plan. And if they're not, you have every right to demand better. If you're a healthcare provider, this is your invitation to listen differently, to recognize that standard protocols might need cultural adaptation, to understand that noncompliance might actually be a failure of the system, not the patient. And if you're simply someone who cares about health equity and justice, remember that support can take many forms. It might mean checking in on a friend with a chronic condition. It might mean advocating for policy changes. It might mean educating yourself about health disparities so you can be part of the solution. The revolution that Greta Wiggins Randolph embodies isn't just about surviving with type 1 diabetes as a Black woman. It's about thriving because she refused to let anyone else write her health story. So today I challenge you, take one step toward rewriting your own health narrative. Question the assumptions that have shaped your understanding of wellness. Reach out to someone who might be fighting an invisible battle. Educate yourself about health disparities in your community. Because when we stand together, when we combine resilience with education and community, we don't just change individual outcomes. We transform entire systems. We rewrite not just our personal health stories, but our collective future. And that future, it's one where no child faces a chronic illness alone, where no woman has to choose between being heard and being helped, where health equity isn't just a goal, but a reality. That's the world Greta is helping to build. And with each of us doing our part, it's a world we can absolutely create. Thank you.